for seniors.
Okay, there we go.
Well, thank you both for joining me today.
Yeah, it's Michelle, if I can just give you a little background of why we're here and how we got here, maybe.
Sure.
And first off, yeah, thanks for the video I saw, the 2021 annual report. That was good, just to, I'll say, get people's curiosity and interest going in this. Just to give you a sense of Duncan, for example, just to do a little introduction. Duncan is the head of our Granby Men's Breakfasts. Pre-COVID, we were running 70 guys at breakfasts and things like that. He's also head of our DME, our Durable Medical Equipment Closet. There's a couple other people that one may even be joining partway through this, but just people that I've grown to know in town. I retired from UTC in 2019, and I'm on the men's breakfast with Duncan. I'm on the Commission on Aging here in Granby, as well as I was on the long-term recovery committee that we had last year during COVID. To give you a sense of the size of Granby, it's about the 2019 census it's 11,000 people, 2,000 of them being seniors, probably maybe 1,000 dwelling units, 400 are probably living alone. And our senior community center has 500 members. So it's only about a quarter of the population of seniors that we have. Yeah, there are some that live in, whatever, senior communities that there may be some neighboring going on in that, but what happened was there are some falling in the crack. A couple of instances where people are trying to transition from rehab to homes that were not fit to move back into. So I kind of teed up the idea with our commission of some sort of a volunteer organization. And our senior center director says, well, something already exists out there called UR Community Care. So I said, okay. It was kind of the tail end of the meeting. We didn't have much discussion. So I said to myself, let's start doing some homework. And that's when I contacted you. I guess the goal out of this discussion, I would hope to just an overview of the process, certainly. And certainly I think in the report highlighted security, maybe safety risk, that get a sense of the functioning of the website, that kind of how it works. And I think my perspective so far from the input that I've had from several people, they said, start small with this. Don't go for a home run. And I equate that to maybe what Clinton, in your report and all, maybe what Clinton is doing is the home run. But the input so far is start small and kind of test it, prove it before you expand it, just based on the information so far. So I guess with that, I'll let you run the show, and maybe hopefully we have some time for Q&A, and then we can let other questions flow afterward,
Sure.
after people digest things.
Sure, absolutely.
Okay, thanks again too. This is great.
Oh, you're welcome. And I'm glad that the Senior Center did tell you about the organization and you're able to find out a little bit more about us. So thank you both for joining us and anybody else that's watching. So you're correct. We are a secure website for older adults and people with disabilities to get connected to local volunteers. And that's where, today I'll go over what the services are, who can get involved, the volunteers and our partners, how the funding works, our pet community collaborations we have across the state, and how you guys can get involved in Granby. When people are looking for help at home, and they don't qualify for certain state services, those are the people that you're talking about that are in those gaps. So they don't qualify for state aid. They might be living alone, widowed, whatever the situation is, and they need additional services, whether they're going blind, they can't drive anymore. They need additional services directly at home. And these are the categories that we have volunteers helping in. So community members, those are the people that are in need of help, can ask for help in these categories. And it's really beyond these categories, but on our website, yourcommunitycares.org, is where you could see the complete list. And all of these activities that volunteers are doing are all free for the community members. So all services are provided at no cost.
Okay.
So if they were to hire a private caregiver or a handyman to do, change a light bulb, even though it might not be that high, but for the person that can't reach that light bulb, these expenses can be astronomical for people that are living on a fixed income. So it saves them that cost that just local volunteers can help them with a variety of chores around their house, which is really a big cost savings.
You just reminded me of my neighbor across the street. He was afraid to climb up on a chair to change a light bulb in the ceiling. Yeah. Okay, I get it.
Yeah, it's little things that, if they're recovering, they're coming home from a rehab facility, they're recovering at home and they can't take their trash out, especially in these icy wintry conditions like we're going to have tomorrow. It just highlights that this is something that, you've got 70 men, you said, were doing these breakfasts and things. I mean, this is a great opportunity for people to then just kind of pivot and do other things around town if they're interested. It all goes down to whether the volunteers are interested in helping other neighbors.
And I think there is an element of that volunteerism in our community because it's relatively small. But there are not only like with the DME closet that Duncan has, but also with the food, we have several food distribution points that are meeting needs out there.
Yep.
But we have situations like from a legal perspective, the DME folks are told not to go into the house delivering maybe equipment and things like that. So this seemed to be even bridging some of the gap for those kind of things.
Yep, dropping off food from food pantries or from the DME closet. Those are certainly opportunities where volunteers could do that drop off or pick up. So people qualify for our organization if they're over the age of 70. And these numbers might change as we're growing, but we know the need is so big that we've set the number at 70 and anyone that's 18 and older with a temporary or permanent disability. So that means if they're coming out of the hospital or rehab for a short period of time and they're disabled, or if we had a woman after a pregnancy and she was, technically disabled for a short period of time, they would qualify. We haven't actually told anybody they don't qualify, but a physical disability is what these are our qualifiers right now. So people that need help, they go to our website, yourcommunitycares.org, they enroll, which means they put their demographic information in. We do a background check on all participants, unless they're under the age of 18, we can't do a background check. And then once they're accepted, they would then go into the website and put in those requests that they need help with. So any of those categories we just discussed is where they could put in a request for help directly on the website.
Michelle, have you had any instances where individuals were reluctant to, as Skip said, cross the threshold for liability reasons? Or would they just not volunteer in the first place?
Yeah, people that aren't comfortable, they just wouldn't volunteer in the first place. Yeah. If they felt what they're going to do is once the volunteer signs up, they're going to be able to see in their profile what is the volunteer opportunity. So if they decide that that's not something they want to do, then they can just skip that opportunity. So if you have 15 people signed up in Granby, all those people, all those volunteers will get an email once the community member makes the request. They decide which, it's like a first come, first serve. So if the both of you got an email and you were, signed up as volunteers, you'd get an email when that person put in the request. And you could decide if you were available, one, or interested, number two, and then you decide which opportunities you're going to pick.
So
So
if I'm that volunteer and I'm going into somebody's home to change a light bulb, and I fall off the ladder, am I carrying my own liability insurance, or am I counting on the fact that the homeowner is carrying liability insurance or homeowner's insurance so that I'm covered if I break my leg?
well, you have medical insurance, I would assume, but
Not everybody would. Not everybody would. I do, but not everybody would.
so it would first go to the person's personal medical insurance, and then if you decided you wanted to sue the homeowner, it's really up to the volunteer. We've written the terms and conditions, the privacy policy and the policy and conditions. It's between the two parties, so it's between you and a community member. If you decide you want to go up that ladder, that's not really something we've put into our terms and conditions that you're going to do. These are safe activities between you and the community member that you consent to do.
Okay,
So
so you're acting sort of as a broker, if you will, between the individual with the need and somebody who's willing to help out.
yeah, we're the conduit, the connection of the two parties.
Okay, thank you.
Yep, but we do have our own liability insurance, our own automobile insurance. If we did have to use it for any reason, we do have all of the insurance as well. And then the volunteers are not doing personal care. There's no showering, there's no electrical work or plumbers. They're just everyday activities that you or I could do. Filling out paperwork, applications, some of these things are kind of time consuming, and people that have difficulty writing, that are trying to get on state services, or maybe they're gathering, 5 years of their statements and they've got to get to the bank or whatever it might be. Many people can refer people to the platform. So whether social workers can identify people in need, or the high school identifies volunteers that would like to help, it really does allow town departments to better connect their residents so that they can identify. We've gotten a lot of calls from libraries that they recognize that someone has a need and they're referring people that need help. Housing authorities or other nonprofits can become volunteers. Church organizations, their youth leaders and members can become volunteers. So it really allows multiple people in that town to directly use the platform if you start promoting it. And that's where it's been so successful in Clinton, because they've really promoted it at a town level so that they're all referring people that need help and then referring people that want to give the help. And that's why it's been so successful. The same thing here in the town of Manchester. It just builds from, you've got to get the town involved in getting people to use the platform and recognizing how easy it is to connect to one another using the platform. So we've really grown across the state, have this isn't really up to date, over 1,000 users right now of the website.
Yeah, I think Michelle, you had said there was a couple people in Granby already using it. I wasn't sure if those were volunteers or whether those were people receiving services, but
yeah, and that's why, we only have a couple in Granby, because we're kind of being more strategic now. We're targeting those towns that we have funding in, because we know the need exists, so that more and more people are calling us every day, wanting to sign up every day. But to keep this free for our users, we need funding to be able to help support all of this going forward. So we're really targeting those towns that we have funding in to get those community members that need help and to get the volunteers.
But if I wanted to volunteer for somebody, say even down in Simsbury or in another town, I could do that just as an individual still, right?
You'll get emails within a 15-mile radius of your house so that you can choose which opportunities and which towns you want to travel to. Absolutely.
Okay, all right.
Yep. So a whole bunch of people are referring people that need help, but also volunteers. And it sounds like in your town, you'd have that outreach to people that might want to volunteer. So that's great. That's a great starting point of who would want to start to get involved.
Yeah, I think there's informal networks that happen, but to try to, once you start advertising a new, like say a new platform, that's where people start to ask the questions like Duncan with, okay, what's the liability aspects of it? And what's the, especially to the town itself, is because that was the initial, in our Commission on Aging meeting, the initial reaction was, okay, who's doing the background checks? And we really didn't know anything about the platform at that point.
Mhm.
You know, driver's records, background checks, and safety kind of issues. You know, there's one person that did ask, you know, can two people actually volunteer together? So there's safety,
Yeah.
like say two ladies want to go together, they can do something like that too.
Yeah. Yeah. There's so many options. You know, as long as they're in the system, they can call the individual and say, you know, Sally and Pam are going together, whatever it might be. It's between the volunteer and the community member. So in the email request, it would say on the purpose line, you know, I need a ride from Enfield or to Enfield to the doctor's appointment. And, you know, it's all written in there. So you know what the person needs so that you can identify it's something that you feel comfortable with or you don't. Or if you decide it's a companionship and that person wants, you know, just to be talking or whatever, some people do virtual companionship. So they'll do phone calls on a weekly basis rather than going to someone's home.
Okay.
So it really can be whatever you're interested in. So these are some examples of some of the town and municipal funding. And again, in Clinton, they used Families Helping Families, which is a nonprofit, along with People's Bank, which gave donations to the organization. Town of Manchester and Bolton, these are municipal budgets, so that we're actually in the town budgets in those towns. And then other funding opportunities are community foundations or, you know, different grants that we've received across the state. So that would be something we could look at in your area too. What grants are available in some of the town in your town?
One of the challenges that we have, the men's breakfast that we have over 200 members. It's a senior men's breakfast essentially, although we've dropped the word senior trying to attract younger people. So we don't want to age out and just throw away. But about 10, between 10 and 15% of our members either don't have technology in their homes, they don't have access to a computer, or they elect not to give us their email address, one or the other. So we end up having to contact our members at 10 or 15% by phone just to advise them what we're doing with respect to the men's breakfast. There's a perception that there's a large number of seniors that are in that void where there is no technology. And from what I'm hearing is that those people are not even on your radar. You're dealing with the ones that have access to technology.
No, there's actually, so we have partners. So we haven't gone over all the ways that people can get signed up. So people can get signed up through a partner, so that if the men's club or whatever the breakfast club whatever you want to title it, there's two partners. One could be the partner of volunteers that want to go together and volunteer. So a partner is, you can enroll multiple people in one account. So a community member partner would be that maybe, say, Duncan, you were in charge, you were the administrator of this account. You would sign up anybody that doesn't have access to the internet. So they would call you on a weekly basis and say, hey, Duncan, once they're signed up, we do the background check, they're enrolled. Then you would have your call tree, and maybe you have 10 people on your call tree that you know don't have access to the internet. On a weekly or monthly basis, they would call you and say, hey, I have a doctor's appointment this day. Can you put in an appointment for me? So you can manage those accounts for people that don't have access to the internet.
As long as they're willing to ask for help.
Yep.
No.
Yeah, of course, we can't make anybody ask for help. They have to be willing and able. Yep.
And that was my impression of when I read about partners, Michelle. And I'm assuming a person filing for this could be a resident or maybe some sort of a caregiver advocate or even a power of attorney. But it's always, there's the right, I'll say, legal wicket of that person is, I'll say, requesting some services per the service agreement. Is that correct?
Not sure exactly what you're,
So
so
say
nobody else can, I mean, that person has to be agreeable. So
Right.
if that person, you know, we need to do a background check on them. So we need to have their consent and their information in our system to be able to background check them. And then, but certainly if someone had a conservator and that conservator wanted
Okay.
to run their account for them, absolutely.
Yeah, I guess that's what I'm thinking, conservators, or something along that line.
But the person
So
would have to have the understanding that when a volunteer comes to their house, they need to be accepting of that. So that's the hard thing, is that, you know, we all have good intentions and want to help everybody in the world, but people need to be accepting of those things.
Okay.
But yeah, anybody could run another person's account. If that person had a family member in California, it doesn't matter where they're located, they could still run that account for them.
Gotcha. Yeah, because I guess that's what I was also thinking. Those that are caregivers, whether it's children,
Mhm.
children, or like I say, a power of attorney or somebody like that can also be part of the process. Yeah.
Yep, they can run their account for them, absolutely. And we know there's just so many community benefits, whether it's for the member or the town, improving community relations. Many towns are putting, you know, more and more things on their website. You know, you've got to sign up for this or look for this online. And it does allow members to get more connected to volunteers that can help. You know, if they bring their smartphone over and they're like, oh, can you search the internet and find this for me? You know, they can kind of be that connection to the outside world that if they don't have technology is very frustrating. We know that, but many people still don't want to have technology for whatever reason.
I think it's not only the technology itself. A lot of them may have emails, but they fear using it, especially when it comes to web searches and things.
Yep, and scammers and things like that. Yep, something that we're faced with today.
Sure.
And then in Hartford County, we've partnered with ECHN to help these little furry animals that are left at home when patients go into the hospital. So that type of support system was already in one of our categories, but it's just more highlighted by ECHN recognizing that more patients were checking out of the hospital because they wanted to care for their pet at home. And we want humans as well as pets to be cared for. So we've started a partnership to kind of help promote this program to support more patients that feel they're home alone and need some more assistance.
That's good to see, because I'm thinking of one circumstance that was brought to my attention. It happened because she was taking care of this other person's cat.
Yeah.
And you found out the house really wasn't fit.
Yeah. Yeah, I just recently had someone call me. She was in Colorado and her brother lives in Mansfield, and you know, he's had no plumbing for a year. And it's like, you know, families have a hard time stepping in and kind of reporting what's going on. And so we do try to provide resources for people as much as we can in addition. And that's why I'm on a lot of these senior councils and multidisciplinary teams of getting information on the different regions of the state of what's going on, what are additional resources for people. So that's something I could be looking into in Granby, as well as other regional teams that they might have going on. So I would be looking for that as well. So all of the grants that we write, the municipal funding, it all goes into the insurance, the background checks, and the technology of the organization. That's where majority of the expense goes. So if your town decided to donate $1,000 a year, we'd be looking for, about 10 people to sign up. It's about $100 a person. That is the cost of the insurance, the background checks, and the technology. If you have one person that's come in from New York, that's a $95 background check. A driving history is $24. A regular Connecticut background check is $36, in addition to the insurance and all the technology to keep this all going. So it's basically a $100 enrollment fee for each individual. So if that person needed a ride 10 times a year or one time a year, it's still an enrollment expense to the organization. Does that make sense?
Yeah, this is beyond an individual just acting on another individual's behalf. This is where you're bringing a town perspective into it.
Well, no, like Clinton. So every enrollment that we have in Clinton is cost the organization about $100. So
Right.
we know that equates to, so if we had $1,000 donation, then we would enroll 10 people in that town. So however the funding works, whether it's through a grant, whether it's through a nonprofit, whether it's through a hospital, whatever the funding source is, it comes down to about $100 a person that it costs the organization. And that's why I was saying at the beginning, we're really only targeting those towns that we have some type of funding in, so that we can keep this all going. Otherwise, we're being inundated with so many signups that we've got to make sure we're targeting the funded towns.
But say hypothetically, say if the town doesn't want to get involved at all with this, I could still go on as a person individually, sign up or is at no cost. Say if I just wanted to do it because I feel it's the right thing to do and for myself.
You could, but right now, at this moment, we're targeting the towns that we have funding in. So we've just received a grant in Southington for $5,000. So we'll be targeting Southington. We just received Middlesex County for $2,000. So that's all the towns in Middlesex County that we can target. So we're targeting more strategically right now because we're having so many people wanting to enroll.
Okay.
So
Yeah, I just,
Michelle, when you say you're enrolling an individual, or is that the individual who needs the care or the contact, or is that the volunteer, or is it both?
Both. So all participants are treated the same. Everybody's background check, everybody's on the insurance, everybody goes into the website. We're now
So if Granby said, okay, here's $1,000, and 10 people that want to be volunteers said, okay, raise their hand, you check those 10 people out. But there would be nobody that would be checked out with respect to needing the care, being able to ask for care. Is that correct?
well, we'd probably only do 5 to start so that we would have 5 community members as well.
okay.
You're saying.
So we kind of have that balance of those people that need the help, we call community members. The other folks are the people that want to help are the volunteers.
Okay, and so you would have to have a one-to-one relationship, basically, if in an ideal world.
No, it could be a 2 to 1. So if you had, if you wanted 7 community members and 3 volunteers, you guys could let me know how you want to structure it. It just depends on if you think those volunteers are going to be that active and be able to.
Cover those 7 people.
Yep.
Okay.
When I saw in the annual report, it referred to it as a scalable solution. Is that what we're talking about here?
We mean scalable beyond Connecticut. So our goal is to be a national organization that helps support all communities. So a community like yours, it's looking for options to help support residents directly in their homes. That's what more and more communities are looking at, is how to, and that's what I mean by scalable, that our website can be in any state across the US.
Gotcha. Yeah, I guess I thought it was maybe scalable in the terms of the idea from an individual level to a town level or something, but okay. All right.
Yeah,
I guess
so-
I can.
Our website is all matched by zip code so that you're matched within a certain zip code in your area. And that's why you'll get requests within 15 miles of whatever zip code you put in there. So
Okay.
that's what makes it easy to be scalable, along with some other additional features. But so the community member is the driver of this. They sign up, they put out the request, and then that is the request that goes out to volunteers. So you're right, if you don't get any community members to sign up, then the volunteer's not going to get any requests. So you've got to kind of start to recruit people that are interested and need some help at home, whether you're talking to social services or you've already identified those folks that are at home and might need some help through the Commission on Aging. However, you're identifying people, kind of getting a sense of who needs the help, and then deciding if you want to have a partner account so you can sign up people that don't have access to technology, if you'd be willing to run their accounts for them.
Because I would think in as you try to grow some roots in the community on this, that you would need a partner to act as a liaison for the hundreds of questions that come, unless you want to, you're not staffed to field all these questions. So it seems like a community partner within the community is the logical thing to, if you call it a volunteer coordinator or something there,
Yeah, we call them a hometown hero. So the lead person in that town, so Clinton's hometown hero, she'll field a lot of the questions. If someone's having problems with technology, she'll go to their house, show them how to do it. So the hometown hero is really the person that really is more of a
liaison,
volunteer coordinator and a community member coordinator. She'll get a list of all of the volunteers and coordinators and community members. She'll be able to email them on a monthly basis to say, hey guys, does anybody have any questions? She'll get their phone numbers to make sure she can check in with people that don't have access to technology. So that person would be the kind of glorified volunteer that is in direct contact with me, so I can help support outreach throughout the town, creating flyers throughout the town, drop-offs of whatever, make sure this is successful, of getting newsletters, press releases, stuff like that, so we can really make sure we make it successful.
Okay, because that's what I was thinking in my mind was necessary to grow some roots of this into the town, to get at least some small level of usage. Then people start trusting, seeing the process, the word, be it marketing and the advertising or word of mouth. But it seemed like this had it could start as a very grassroots level kind of a thing and then
Absolutely.
grow. Okay.
Absolutely. It's really as much as you put into it. And it's really, it grows from there. It grows into these friendships. I mean, we just did in Westbrook, we used their public access channel, and we went to Clinton and we videoed one of the volunteers and one of the community members, and we're putting this kind of mini commercial together of seeing the connections and the friendships. And now, they're calling each other on the phone, and it's just been amazing to watch the friendships that occur out of all of this, because it's like a support system that you identify people that are, widowed. He talks about being, his wife had passed 3 years ago. It's been the worst time of his life. And now having the support system of having people through your community cares, it's just, it's an encouragement to him that he can continue to have some support system at home. And we have another community member that his house just burned down, and he has volunteers doing a variety of things to help him through this very difficult time. So it really does help promote people coming together for the better good and supporting one another. So those videos will be out very soon. So I'm excited to be able to show not just me talking, but the impact that it can have on real people's lives, like you guys have seen with all the volunteer work you've done in your towns. It sounds like you've been great advocates for that.
The other thing I have in the background is my daughter's over in Scotland working for a nonprofit. And what they're trying to do is something similar, I'll say, get a group of volunteers to meet the elderly, not just for services, but for befriending as well. And
Yep.
so she said, Dad, this is right up your alley. So she's she's a little more professionally trained in this. So I'm getting coached a bit from her. But the idea of the companionship was as important as the services.
Yeah, it really is. It really goes
Okay.
a long way because people have no one to talk to, or they might have family in New York that, visit once a month or once every 2 months. And that's not a lot of companionship. And actually Scotland, we're doing sort of a Windham County.
No, I mean Scotland, the country Scotland.
Oh, okay. I thought you meant Scotland, Connecticut.
Yeah, not Scotland, Connecticut. No, no, she's across the pond there doing it. So.
Oh, that's awesome. And so then we hear like another success story is just June, who widowed, lives alone, health conditions, no transportation, and just getting someone to come and help and listen to you and talk with you and help you do projects around the house. There's just such a big impact on how people are helping each other. And you're right, we're a small board. We are 100% volunteer at this point, and we have a lot of pro bono professionals helping us, but we are 100% volunteer.
Okay.
So yeah, that's a lot about us, and welcome to answer any other questions that we haven't gone over.
I think for me, one of the things I wasn't, when I saw the slide, or because I had seen a slide deck earlier, hopefully we can get these to share. I'm assuming.
Oh yeah.
Yeah.
The presentation, sure.
Sure. But I guess one of the things I wasn't sure about when there's the use of liability or the, liability insurance, but that is for the people. And that's for, I'll say, the UR community care people itself, not for the community members or the volunteers. I think Duncan's question brought that out, that the personal liability is on the person itself, on the volunteer. Is that
right? So if they broke their leg, they would use their medical insurance. If they then needed to sue the homeowner, they could do that. If the homeowner then wanted to sue us, I mean, it's all, the liability is,
gotcha?
we have insurance for that. That's what we're insured for.
Yeah, but you did the background checks, the driver records and things like that are all part of your system.
Yep, right now. So we'll be relaunching our website in the next couple of months, and that background check component will be directly when you do your sign up, will be in the sign up process. So we're in a transition phase of updating the website. So some things will change in the springtime, but yes, right now we're doing all of the
and to do that, I think somebody has to give a social security number, right?
Mm-hmm. Yeah, that's the only way to do a background check.
I think the question will be is how secure is the website, since everybody's always worried about that these days. How
we have the most secure website that is offered by our hosting site. So it is secure on the front end and the back end. We have encrypted emails. We have the most secure website you can have.
Okay. And that's beyond my pay grade of how secure is. But that's a question that comes up. So that's why I wanted to at least,
everybody's worried about security.
Yeah, the IT security. Okay.
Yep.
Michelle, staying on the subject of background checks, is a background check a background check, or is it like I'd like some tea, and all of a sudden I got 50 different options of tea, so that there's a background check at level 1 all the way up through level 14, or? So
we do 7 years of state and federal. 7 years of state and federal background checks.
So the communities that you are working in, that are supporting financially, is part of your process to ensure that the background checks that you're doing are acceptable by the social services or human sources, social services, police departments and so forth of that community? Or do some communities have a higher standard for background checks?
No, we have the highest standard, 7 years of state and federal. So we don't do fingerprinting, we don't do, we don't do that, but this is 7 years of state and federal. I'm not sure what else would be included. What do
Well,
you?
I have a military background, so when I think of background checks, I'm thinking about people walking around knocking on doors and saying, "Can you tell me about this person?"
I'm sorry, I'm not sure what that means.
It's the level of detail or level of the
It-
depth within that background check. I mean, I could,
Or maybe said another way is when I had my security clearance at UTC, because I was working on government contracts, somebody came to actually knock on the door and say, do you know Skip Mission, and actually validate to that level, but I
Yeah,
don't
we're
think
not a federal program. We're not military, we're not federal, so that
so,
would,
so if we were going to go to our town officers and say, what do you require background checks for certain individuals? What program do you use? It could be substantially more in depth than what you're doing, or it may be the same. We don't know.
yeah, because that would be a state employee or a federal employee, and these are volunteers. So we would not be in the same category, if you will.
Michelle, a thought along this lines is, do any of the towns ever say they want a reference or a referral for a volunteer before putting them into the system?
No,
Just
no, the towns don't dictate any of our organizational processes, if you will.
yeah, I just didn't know if that hometown hero maybe even did a little bit of a validity check kind of the person by knowing the people in town before they actually maybe sign up for it. I'm just going off of what Duncan was saying, that's all.
So what I'm hearing is that the town has no liability whatsoever because the relationship is between the community member and the volunteer, and your organization essentially is providing the website to connect the two together.
Correct.
And so the town is not endorsing you at all. Is that
Well,
correct?
they've included us in their budget, which is an endorsement in itself, that we are collaborating to help support their residents in those towns.
Okay.
So we're not following any town. They have 20 different community partners in the town. So they're not asking those community partners to follow the town rules of hirings and firings and all of that. We're different organizations and we all have different processes in place. So whether all the food pantries, do the same types of background checks or different collaborators, I'm not really sure. All I can tell you is what we do in our organization.
Okay, thank you.
And I guess I'm not sure, this may be the where you're poking at a bit here, Duncan, is when you put the community label on it, when I say this is Granby, yeah, what liabilities does that open the town up to? And I think that's what you're getting at, Dunk.
Are you thinking that the town would be the funding source?
It could be, it may not be, but just,
At this point,
I can envision, and I'm just sort of playing devil's advocate here, but I could envision somebody having a problem and suddenly the town of Granby is named as a participant in a lawsuit. And it would just come right out of the blue for them because they may not have any
Well, if it's a
inclination that
town,
something like this is.
if we're having funding with the town, we'd have a memorandum of understanding or some type of contract where it's all identified in a contract if it's in municipal funding.
Okay,
So that's up to the town.
But if it's grant and donors, individual donors and things like that, there's no contract, if you will.
I guess I'm a little sticky on this point, because if our senior center is endorsing or asking its members or the seniors or even the community, the Commission on Aging is support, saying, hey, get involved with this. And that's an endorsement, and they are either a board appointed by the town or the senior center is a part of the town's structure. Does that then open up the town itself to some kind of potential liability?
Well, does the same go to, does the town support the breakfast club or anything else? And if something happened there, somebody got spilled with grease or oil, or somebody slipped on the floor. I mean, any scenario could happen anywhere in the world, and anybody could be set up for liability. But, you know, you either decide, you know, it's something that you're interested in, or it's not a good fit. But liability is there whether you walk out your door or it's everywhere. So I understand your concern, but
Okay. No, I think that
background check is what we do.
that gives us a sense as to how far you go versus what, where the responsibility then lies outside of your organization.
Yeah,
Okay.
we're a 100% volunteer organization. So at this point, the terms and conditions, the privacy policy and the policy and procedures, that's listed at the bottom of our website. You could read through those. We've tried to put the onus on the community member and the volunteer. Those two people decide to engage in some type of community deed, whether it's you go there and you rake their yard or you go in and have tea with them. It's between the two of you to work out the details of that request.
Okay, thank you.
Got it. No, that helps, Michelle, just because I know that it's always, okay, so,
It's always a sticky situation.
sure. That's why we have too many lawyers, but anyways. Oh, that's right, this is being recorded.
Yeah, neither one of us is a lawyer, so.
Right, you can tell.
It's
Well,
okay, Peter.
I was the face to the government over at UTC for a number of years, so it was always, the lawyers were always involved.
Yeah, and if you have any other specific questions, feel free to reach out to me if anything didn't get answered today, or if there's more questions based on the recording, I'll get that sent over to you later.
Just a quick one, just kind of scanning my list. Training of volunteers, is that?
At this time, it's town by town. So Clinton, their, police department puts in a little bit of training to volunteers of elder, things to watch out for, scams and things like that. But on a statewide level, we don't have the capabilities of doing training right now. So we have a volunteer handbook that we will email out to people that kind of gives you the guidelines. If you wanted to set up some type of program where you did some training in your town, then that's welcome. But these are everyday chores that people are signing off on, those 3 documents that I told you about, and hopefully they can fold laundry properly or do the dishes without training and doing things that don't really require training. It's just that handbook kind of reminds them of the.
Yeah, I was just thinking
things to
even in terms of just personal communication skills.
Yeah,
we can
hopefully as we grow, we'll be able to do that. But right now, we're just sending out the handbook at this point.
Okay.
A lot of goals for the future.
Oh, absolutely. Yeah, this is kind of, okay, so where are we at today and how could we use this?
Yep. Yeah, we're hoping to grow to an app and all kinds of different things, a call center one day, but this is just, we started 6 months before COVID. So it's been a challenging and interesting few years.
Looks like you've had a pretty successful couple of years too, and
Yeah.
very difficult circumstances. So congratulations to you.
Thank you. Yep, we're definitely working hard to meet the needs of the community, and that's where we've kind of pivoted our approach, and we really need to be more aware in this 3rd year of community support can be funded in some way, community by community, and that's really what we're pushing for 2022.
Do they, if somebody wants to support, do they say for donations,
Hmm.
is it a donation directly to you? Not to, I say, a central, and then, we write one check to you kind of thing. I would think it would be directly to you.
Yes, well, not to me, but to the organization. Yes, so yourcommunitycares.org, you go on there and you could donate directly on there if you wanted to donate $1,000 today. And you said, I only wanted to support residents in Granby. So then we track it like a grant. So we basically would track that so that all the background checks that come from today forward would be tracked. All the insurance and the website expenses, all that would be tracked just like a grant. If someone tells us they want it just for a town, and that's like what we do in Clinton, we're tracking it per town. So if there was a business in the town of Granby that wanted to help support this, get a tax deductible donation, they could certainly donate, and then we would track it just like a grant.
Okay.
If I were running that business, would you be reporting back to me on some basis as to what you were doing with my money?
Yeah, we would give you quarterly reports, just like for the grants.
Okay.
Yep. So that you would know how many people are being signed up, what is the impact story, try to give you all those metrics. Just like on the grants, we're tracking it all the same, just to be consistent.
That's good.
Yep. All right, let me close this recording because it takes a minute to takes a while to actually get it to close. I want to make sure I get it for you guys.
Okay, because I know when I have my classes that I teach and there's some recordings, I'll get a link that I'll send out to the email, send an email out to the class with the link on it afterward.
Yep, I'll do that as soon as I can after we close up.
Okay, I think you've given us plenty to digest, and we've grabbed an hour of your time. Yeah, I probably more questions, more interest. I know there's a couple other people that weren't able to make this, but I think this gives us a good sense of how this could operate for us.
Awesome.
But all right.